But health insurance in this country is framed so, the way it's framed is, it's something that you have to use for everything. And insurance is not built for that.
Finally finding me. Third eye opening up so I can see. Finally I can breathe.
Welcome to the Howdy Houston podcast. Today we're doing the business showcase with Sunil Vasisht with Meridian Springs. He's also president of MedPrime Direct. And I know Sunil from the Woodlands, Conroe area. He's in a few of my networking groups. What he and his wife are doing is pretty amazing stuff, in my opinion. So we'll get to know Sunil talk a little bit about the healthcare industry, and for business owners, for families, for individuals out there that struggle with health insurance. I think this is going to be a really good conversation for you to listen to. So, Sunil, welcome to Howdy Houston Business Showcase. Please take a few minutes just to introduce yourself, and if you can, talk a little bit about your story with Houston and how that connects with your business.
Sure. Thanks, Chris, for having me in your podcast. And, I wanted to be on this for some time. So today is my lucky day. So I'm Sunil Vasisht. I am the co-founder of Meridian Springs Primary Care. It's kind of a Netflix for healthcare. But again, it's kind of misleading when I say that because it's not just virtual. It's the model is a flat fee primary care that you can get for a flat monthly fee. It's less than the cost of a cup of coffee a day. It's like $75 a month for adults and $10 for kids, up to 21. And so you get unlimited visits, access to the doctor. So this is an MD practice. So you get access to the doctor, and then there's no visit fees. So that's pretty much like, just like you binge watch on Netflix, movies on Netflix, you kind of binge get your primary care because sometimes you need a lot of it. Sometimes you might not need it. But the whole point is, see, if you go back to what people need from a healthcare, they need two things. One is you need a good quality healthcare. That means a quality is the outcome. The outcome of your healthcare. A visit to a doctor should be very beneficial to you. That means your health issue was fixed or found out and all of that. And the other thing is that should be had at a very decent price point, which is affordable. That's all people need. And of course, it should be accessible, right? So you get that when you need it. So other than that, everything else is a fluff. There might be a lot of big promises in healthcare, but it all comes down to these two major things. I want my healthcare outcomes to be good, and then I want it at an affordable price when I need it, right? And that's what, and that's how this whole model, the core of this model is to make that happen. Providing a quality outcome in a healthcare translates to a couple of things. One is your qualification and training of the provider, right? When you say a healthcare provider, it means so many things. It can mean doctor, it can mean nurse, it can be so many other people that go by provider. But the one that's highly trained to fix health issues, they've spent years in their training, that's the MD. So that is number one, is your healthcare provider a physician who is trained? If it's a physician, then they are trained, highly trained. Number two, even if they are a physician, highly trained, they need to have the time to spend, right? You might go to a doctor's office and they only spend, averages between 7 to 10 minutes. It's not really much of a time for bigger issues. Of course, if it's a small thing, it's fine. But if you really have to explain your problem to a doctor, then that's not enough. So, but when you have these two, that is a highly trained physician and then the time to listen to you, when those two things are there, then it's basically quality that translates to high quality. So that's what we provide. And then the other point is making it a flat fee. You don't have to think twice to go visit your doctor, because now there's no visit fees, there's no deductibles, copays, no surprise billing, nothing, right? So now you're like, oh, when I need it, I can go. And it's not just, it's not just in-person visits. We cover virtual and in-person. So many times you don't even need to come in. If you're already established as a member with us, the doctors know, the doctor knows you, they know your health history. So all you need is just a phone call or a video chat or a quick message that will probably take care of most of those issues. So all of those bundled into this. Kind of a long-winded answer to your question of what I do. But of course, we will also talk about the insurance part of it. That is what my thing is. My company is. I'll talk about later on. My connection to Houston. I moved to Houston, and I came to US in '98. So I spent more time in US than my home country, which is India. So I spent more time here. I came here to do my grad school. So I have a master's in electrical engineering, and very different from what I'm doing today. And then in 2000, when I graduated, my first job was at Compaq Computers. If you remember Compaq those days. So that was 240. It's in Spring, 249 and Luata. That's where the old Compaq.
Yeah, we talked about that because my stepdad had worked there, I think probably around the same time. And I was really lucky because I was, he brought home one of the first Compaq computers, and we got access to internet like really early on.
Yeah.
You think I'd be a little bit more tech savvy than I am now.
Yeah. So yeah, that was my first job, and of course, I was on the technical side for about 10 years. And then I have designed servers and all of that. Then I changed over to management side, managing teams and managing projects and all of that. And then at some point in 2015, I thought to kind of accelerate my career in the management side, I need to go get my MBA. So I went to Texas A&M, joined the MBA program with Mace Business School. And in the second year, you're supposed to do a capstone project, which is like a 1-year project. Mm-hmm. And for that, I was very clear about one thing. I did not want to do something from my work. I want to do something different, something outside, something I can in the future, go ahead and do those things. So at that time, my wife, she's a physician, family physician. So she was hearing about a membership model in primary care that was kind of like in infancy. It's still in infancy, but in thousands now. But at that time, it was in a couple of hundred, practices across the country that were doing something like that. So she asked me if I can take those things, that model, the feasibility of that model on as a project. That way, I can kind of look at how the business side of it works, have those things ready for her at some time in the future. At that time was what she thought in the 5-10 years or maybe 5 years in the future, that she would probably think of a solo practice and do like an office like that. It looked very interesting, very novel, something new, and something there was a lot of scope of work was there for like a year worth of work. But healthcare, I'd never cared about healthcare before, health insurance. And but that was the first time I opened my eyes when I was looking at the numbers that go into healthcare. And we are talking about 6 years ago. And so if you look at it today, it's like way more than that.
This is and just to recap, what you did during your MBA your MBA process is you went through and put together a business plan for
Yes.
a membership style healthcare clinic.
Yes.
And so this is in comparison to, say, even before the Affordable Care Act, a majority of people got their health insurance through. I mean, they still do, but the majority of people got their insurance through their business plan, where they work. And so, untethered, you have your work plans, you have your affordable healthcare plans, you have a combination of those, and then now what you and your wife have done is you put together a membership option for primary care, and then you also pair that with other supplemental products. And what you've done is you've been able to take away something similar to what Netflix has done. They've basically, you can pick and choose which shows that you watch versus buying into this, large corporation of,
Yes.
large TV contract that has a bunch of stuff that you never watch, and that helps drive down the cost. And that's what was kind of a big eye opener for me. And that's what you mean by the Netflix of healthcare. You get to pick and choose versus having huge contracts with stuff that you'll never even want. Now, you as a professional in the health insurance world, you'll go through that with the individual, with the family, or with the business owner to make sure that those options are customized. But getting back to where you're at, you saw this very early on. You said this was pre 2012 when you started.
No, this was 2016.
2016 when you started putting this together.
Yeah.
So you saw an avenue in the market that was coming, and you and your wife put together this. So you put the business plan together and carried it out, because your wife is the main doctor in the clinic there at Meridian Springs, correct?
In this location, correct?
Okay.
Yes.
Yeah. So before we get into the nitty gritty of the health insurance side, I'm actually curious about the operations. If you can, I think you were leading there, but tell me the story of how you and your wife paired together to put this offering out. What it's like working together, as business owners. I'm really curious about the personal side of that. So if you can continue, I think you were leading there, but feel free.
Yeah. So let me take it from the project completion. Once I looked into the numbers, it made a lot of sense, and it makes sense to have a kind of a Netflix kind of a flat fee plan for primary care, because primary care actually can fix almost 85% of health issues. So if you look at all health issues that anybody gets, almost 85% of that is primary care.
Mm-hmm.
Most people don't know that. So primary care, can fix those issues, in an outpatient setting in the primary care office. And so I remember the first chapter when I looked at this was look at the other insurance, like the one that you do, like how is an auto insurance? How is homeowners insurance? Like how is any other insurance? It's always insurance it's not a payment mechanism, even though it pays, but insurance is a protection mechanism. So you're hedging against, huge losses. Primary care is not a huge loss, but primary care is something, people don't know, because a lot of, when you are using an insurance, you don't know how much you pay, how many, how much things cost.
Mm-hmm.
But primary care is the least expensive part of the healthcare system, and that's 85% of healthcare. So now, when you bundle everything, the most inexpensive and expensive, everything together, and then you're paying huge premiums on that, it's basically a big waste. So what we have done, and what this model does, is you can remove this primary care part from your insurance plan, and you can have that as a flat fee. That way, there is big, access to the health, the primary care, the quality of care. All of those things are already there without having to go through a middleman, which is insurance that sits between, the provider and the patient. And then using insurance, we never say insurance is not needed. And if somebody says that, that's completely wrong, I think even illegal. Insurance is needed, but in its place. Insurance is needed as a protection mechanism when there's a huge loss. Yeah, if you have a cancer, you need to be insured for that cancer, or some kind of a surgery, then you need insurance. So when things are in their place, when insurance covers the 15% and the 85% is primary care, there's a huge reduction in what you pay into the healthcare system, and then a huge increase in the value that you receive because the quality goes up big time.
Mhm.
And that's the kind of a sweetness that we bring in with this model. And that was my first chapter was to look at how other insurance works and how health insurance works, and how, if health insurance is made to kind of structured it like how other insurance works, how good it's going to be. Right? And that's how we started. And then at the end of early 2017 is when I was supposed to do my report, and that's when I told my wife, it's something we can do it now if you want. We don't have to wait 5 years. And then I graduated May of 2017, and we started this location May 1st, 2017. And so, kind of like, any business there's a business part, and there's the medical part, right? So there's the what you call the technician part. So it was a good thing where I'm not concerned about healthcare because I know nothing, but then I can provide the business side of it. So it works very well because we keep our domains separate. We don't mix it.
Gotcha.
But we get to spend time, which is actually a good thing. And we have lunch, Fridays, and not this today, but usually Fridays we go have lunch together, which we have never done for many, many years, because we used to work in different locations. So all of those things. So when you look at work-life balance, this is the best that I've had.
Let's break down a little bit more on the coverage. So when you say you disconnect the primary care, that leads me to believe that maybe there's some stuff left out that I may need. So, for a business, individual, family, that's hearing that, what's left out? What is, how is it structured differently than, say, my employer plan, or, someone that, even just going through the ACA market?
Yeah. So right now, your insurance bundles everything. Right? The big issues, the primary care issues, everything is bundled when you get a plan. And with those, you mentioned ACA, with the high deductibles that you have in ACA, basically you're paying out of pocket. I mean, insurance doesn't even hit until $8,000, $10,000, which usually you never hit that. So which means basically you're paying all the premiums, but you get nothing. Maybe a preventive care visit, which is free, you get that. So, but that's the crazy part of the healthcare system. You need healthcare, right? Healthcare is something that you need to frequently use, at least 3-4 times a year, to for wellness. Because with this kind of insurance, what has happened is a visit to a doctor has become like a sick care. So I get sick, I go see my doctor. If I don't get sick, I don't bother about doctor. That's a very bad thing to do, because just look at your car. To have those preventive maintenance on your car regularly. You never think about not doing that. But when it comes to us, we are like, oh, I don't want to go to a doctor if I don't need to. And most of the times, what happens is, unfortunately, some small things that are ignored blow up many, many years later into big things. So the primary care is that gatekeeper kind of, the gatekeeper of healthcare system, where they can detect and fix issues when they occur, which is a huge deal, because when they're initially, it's very, very cheap, inexpensive to fix. It becomes very, very expensive later on. So the more you visit your primary care, and it can be just 4 visits a year. It's a wellness visit. You go get your blood checked once a year, get some preventative things, once or twice a year. That's it. So as long as the doctor knows, if there's some pain in the back, go to your doctor. You don't have to think twice, and then have it checked. Because maybe I was at a conference yesterday, and they were talking about an employee that ignored that for years, and it turned out to be a cancer. So that initially, when it was there, if it was detected, very easy to fix that, and not expensive at all, right? So it's always good to go to your primary care doctor as often as you can. And with our model, that's the incentive, because there's nothing else you pay during the visit. You can go, and the doctor's access is there all the time. So that way you can take care of yourself, and you're preventing a lot of the big issues that are going to occur just by ignoring things that you might have had now.
So I'm looking at the Meridian Springs website here, and it shows members and couples, and I'm just going to I'm not going to give the pricing on here, but it's pretty inexpensive.
The thing is, as you might have noticed, no healthcare publishes their pricing, right?
Yeah,
and that's the whole problem. Is when there is a pricing, there can be a competition. When there's competition, there's efficiencies, and then the quality improves, which is there in every other industry, right? Even if it's insurance, you get quote from many people, and then you go with somebody that provides the best value. So if you don't have those prices, then you cannot compare. So and that's if you look at it by publishing the pricing there's no surprise. This is what you get, this is what you pay. And so we make it very transparent, and everything is, if you even get some procedures done, everything is told before anything has to be done. You know exactly what you're going to get. There's no surprise.
Is it okay if I put the graphic on the screen during this part? I wanted to run through a couple of things here.
Oh, yeah, sure. Okay. Yeah, you can.
So a couple of things that really pointed out to me. So number one, the members only is $75 per month, and then the couple show $140 per month. I think business owners may have a similar setup. Is that correct?
Yes. For business owners, we have volume discount. Like if there are more employees, then we provide more discounts for them. And so the couple is for the spouse, it's $10 less. But if they have to join together,
gotcha.
So if they join separately, then it's $75 for them. But if they join together, there's a discount. The whole family together, it's a $160 per month. It's for kids up to 21, it's $10 a month. But it has to be with an adult, so we don't just take the kids by themselves. But so all of these are standard pricing, and for employers, there are discounts that exclusive pricing that we provide based on the number of employees and all of that.
I want to talk about the employer's benefits here in a second, but just to run through the top items that it shows here on the website: unlimited clinic access, same day appointment, physician access 24/7, 365 for e-consults via video, chat, phone, text, or email. Those are the first three things. That third thing is, crazy for me, because you typically don't get that even if you walk into a clinic. It's usually, you set an appointment, a couple days in advance. The e-consults, I think, are a lot more popular, or becoming a lot more popular, but just historically, that's, it has not been the case, especially with the amount of access that you have with your doctor. The extended clinic visits as needed, zero in clinic wait time, no copays was another thing that popped out to me.
Yes,
you're paying, in some cases, an individual is paying $350, $400 a month with a $2,500 deductible, and then they also have to pay the $50 to $150 copay, each visit. And so the cost on this is very competitive in comparison with most other plans. So the one thing I wanted to go back to is, are we losing anything with going with this versus, say, like the standard plans that are out there through, a individual's employer?
This is not insurance, so that is so this is primary care, which is the
Yeah.
85% part of healthcare. So, but if you have this with the coverage for the catastrophic, which is the 15%, your surgeries, hospitalization, ER, then it's the whole thing. So healthcare is the only, see, if any industry, you get what you pay for. But healthcare is the only thing where you can pay thousands and get a crappy service or a quality of care. Healthcare is the only thing that that provides that. So pricing is not really a kind of an indicator of the quality of service that you get. So what we have done is we provide the value. A value means a quality for the price that you pay. Mm-hmm. And that's the thing. So when we make it flat fee, then we are providing you the value of all of the things that you mentioned at a price point that everybody can afford, right? And then people who want more than that, especially if it's employers, then we have a separate employer plans that through my company, my benefit advisory. But even for individuals, we have individual coverage plans that we can, it's called the wraparound. So we can wrap around that, that you get special pricing because you're a member with us.
And that's what I was going to ask, is the Netflix of healthcare comes in using the primary care with those other options to get the full coverage and full coverage, or the amount of coverage that's comparable to other plans that are out there that are through their employer health.
Yes.
I always hate using full coverage, especially in the in the auto insurance world, because that can mean anything. But the Netflix of healthcare pairs all that together, and you help guide them through those selections.
Yeah, I mean, we have those partnerships that we can offer those, and again, it should be very clear that what we provide is primary care. That's 85% of your healthcare, and what we can provide to individuals through our partnerships for to cover the catastrophic part of it, that you don't need those two. You can just choose the primary care part of it. It's all what you want and what you can pay. And but what we recommend is to have the whole plan so that you're covered for the big things and the small. And we do offer these things through our practice, and and it's all available. And we do have meet and greets where I do explain to them. So each one's case is different. Gotcha. So what can be done, what can't be done. But of course, it's their decision eventually what they can. But we put everything on the table, and you can choose what works for you.
So let's talk specifically about business owners. And so the biggest one of the, I'm a fairly new business owner, and I know that a lot of people out there that are watching, especially here in the Woodlands, Houston area, started businesses within the last couple of years. I think it's probably the most, like the biggest point of time where people have started new businesses, new ventures, whether that's, becoming a realtor, small business owners, whether you're selling products. So one of the biggest, things to think about when you're hiring is how I'm going to compete with, other larger companies that are offering the benefits that in some cases can be, a tremendous cost to the business. And so in using Meridian, using this plan, and with pairing it with other supplemental products, tell me a little bit about how you compete with those, traditional employer setups versus the individual, versus small businesses that don't have anything, and how do you connect the two in terms of cost? And so just talking to the other business owners out there that are just starting.
Yeah, so for employers, so my company is MedPrime Direct. So that's the employee benefit advisory platform. That is for employers. What we do is we provide all comprehensive plans. So this is when you meant supplemental, usually supplemental is like indemnity plans.
Mhm.
But I'm talking about comprehensive insurance plans that covers everything. So we provide that to employers, and there's an affiliate network of clinics like ours that we network and provide that as a whole to the employers for the primary care part. And the insurance part covers everything from specialist visits, hospitalization, and ER visits and all of that. So basically, like any other plan, but many times at very reduced cost, premium cost to the employer. And I put a couple of videos from a meeting yesterday. So this employer uh, provides staffing to like Google and Microsoft, and he was talking about the case where Google said we will only get your employees. We're going to hire them as our workers if you provide a comparable plans like what we do. I mean, it's Google, right? I mean, you're expecting an employer with 4,000 employees to provide a Google-like plan, and so that's when the plan like ours that he went to that because anything if he had gone to a plan we call it the BUCA plan. BUCA plan is the Blue Cross Blue Shield, United, Cigna, Aetna, and Humana. So the big five. That would, he would not have been able to run the business if he had gone to that big plans, which cost very high. So what he did was he went to an alternate funding plan, which is where where when it's everything is unbundled. That means it's the network, the PBMs, which is the prescription benefits. All of these are you can pick and choose what you want and what you don't want for yourself. So you don't have any waste that you don't need, that your employees don't need. So he went to such a plan that Google accepted. So they were like, "Oh, this is a fantastic plan. So we can take your staff that can come work with us." So and the premium was very reduced from what he was paying before with the bukas.
Mhm.
And so that is the beauty of it. And so people are very scared when it comes to healthcare, and they think they can you need a BCBS, you need a United, but then the plans, there are insurance plans that you can unbundle and provide this almost same or even better coverage than the bukas do with a lower cost. And
And
so
that's
now, yeah,
that's a result of using some of the membership aspect of this. Is that correct?
no, the membership aspect of the primary care with unbundled aspect of the insurance.
Gotcha.
So you get the primary care, which is the foundation, which is unlimited primary care, no visit fees for employees. And then on top of it, you have prescription plans, the ones you need. You have the networks, the ones you need, the kind of networks you need, the kind of hospitals you want access to. You want the stop loss insurance where you want all of those things. You can pick and choose what you want, and you can build your plan. Of course, with that's why we are the advisors. So we advise how to build the plan, and these are all fiduciary responsibility, which means I cannot just say, oh, you can go do it because somebody pays commission. No, this is fiduciary responsibilities. It's all legally binding documents, contracts, all of those things that provides these kinds of plans for employers. And the one good thing about this is, how the bukas make money. Not just the admin cost is just 20% of the premiums that you pay.
Mhm.
But if the money that is left behind from your premiums that you have not used does not come back to you, that's also their bottom line. It goes to their to the insurance companies. Like if you have not gone to a doctor and you have paid all the premiums, where does that money go?
Yeah.
That's the profit for the insurance company. But in this one, if you have not used it, the money comes back to you.
Interesting. And then
And yeah,
and the underwriting on this, is that through those major carriers, or is that through some another company that
Yeah, these are stop loss insurance.
Okay,
They are the ones that underwrite.
gotcha. Very interesting. So in this case, though, if your employees are paying the premium, you're paying the premium, and you get to the end of the year and you have all this unused premium, that's going towards the overall cost of the plan.
That is, you get the money back. Like,
Wow.
let's say because in this plan, let's say you've only used the primary care part of it.
Mhm.
So any visit to a primary care is not it's not an insurance claim. Like, as you know, right? Any claim is something that increases your pricing the next year.
Mhm.
Your premiums go up. So now you're gone to your doctor. You have done a lot of visits to your doctor, but that doesn't count. The primary care visit doesn't count as an insurance claim. So what happens is now the insurance, we don't see any claims on your insurance plan. So your claims is just sitting there. Your premium is sitting there. A portion of it will go to pay for the stop loss and all of the other parts of it. But then the claims part of it, it'll come back to you because you've not had a claim. So instead of going to the insurance company bottom line, now it's going to the payer because you are the ones that paid.
Sunil, I have one more question about the logistics on businesses that are looking to maybe make a switch or have some upcoming enrollments. If they make a move or at least come talk to you, what are some of the things that you look at with their current health insurance coverage in comparison to what you can offer? Also, if you have business owners, because I know that, here in Houston, and then even I think you're telling me in other states that you're partnered with, they can choose their own doctor or use the membership option through Meridian Springs, and it helps lower the cost. So I'm kind of curious, if you have employees that are on the north side of Houston versus the south side of Houston, other states, what can they expect in terms of cost and logistics in comparison to what they have now?
Yeah. So what we do for employers is, if they have a current plan, we will, and if they have a current plan for many years, we can take their claims data, if that's available. Insurance companies do not show that, but that's one good thing about us is you have your insurance claim data. So if that is available, then we kind of look at how the insurance has been used, and then how we can, like, sometimes what happens is, some of the employees might need some expensive medication.
Mhm.
Right. So what we do is we write plans to make sure all the things that are needed are part of the plan, and then we look at other more inexpensive. Like, for example, prescription medication is a huge, expensive part of a plan. So we can look at generic options like our PBM, the prescription benefits managers. They, like, for example, if somebody goes to their, let's say, a pharmacy here with a very expensive medication, and what happens is that will become a claim, then you'll get a phone call. I mean, this is a general thing that in our plan, how that works. The employee that went for that to their local pharmacy will get a call from our PBM, which is a prescription benefits manager, and they will ask you, okay, hey, if you go with here, the current plan that you have, it's going to cost you $1,000.
Mhm.
But there is an equivalent generic available. Everything is the same. Or sometimes for bigger employers, we even source it outside. Like we can source it from Canada. So the cost is much, much better. So international sourcing, generics, all of these alternatives are available in the prescription plans. So they'll call and they're like, okay, this is available. Do you want to change over? And then then it's fine. Then the pharmacy is going to give you that, right? So kind of like holding hand where it's necessary, where they can provide more effective, valuable, cost-saving alternatives. If it's international sourcing for the same drug that is $1,000 here, maybe $50 in Canada, we can source it from that. So you'll get a mail order prescription for that. So all of those things on a case-by-case basis can be done in our plan. Right? And then same thing with surgery, right? If you have a surgery, and there was a case that we were discussing yesterday where a person had a brain tumor, and through their PPO, people talk about PPO, preferred provider network for these big insurance companies. But did you know that there's no outcome review of these doctors? So if you go to the directories of these BCBS or United, you'll not know the ratings for the doctors. I'm not talking about Google ratings. That doesn't mean anything about doctors, but the actual ratings on the outcomes, because they have to report that legally to CMS. So without that, you don't know, because they don't publish it. So, but there are systems where we source that, and in the individual's case yesterday that we were talking about, the doctor he had chosen through his PPO had an 8.4 rating out of 100. Right?
How does that even happen?
And that's the thing that happens, right? Which means that the majority of 90% of the outcomes that the doctor was unfavorable.
How do you get an 8.4 out of 100 and still operate?
And still be on PPO? Because I know a lot of insurance agents say, "Oh, we will provide you PPO network." They don't know anything about PPO. PPO does not publish quality scores, outcome quality scores, because the insurance company says that we have to be fair to everybody. So you cannot, like, if somebody has a 90% rating, then everybody will go, right? It becomes unfair. But so yeah, right. I mean, yeah, of course, right.
So what do they look at within those scores?
They look at the outcomes. So that means if you have had like a surgery, if the surgery was successful or not. I mean, these are legally binding reports that you have to do to CMS. So they cannot lie, and they'll be in jail if they lie. So this is fully legal, something that you legally binding that you have to report to CMS, and that is there in a database, but insurance will not look at that.
Are you talking about legal outcomes, like of a lawsuit, or like outcomes
legally binding? They're legally bound to report that, hey, I operated on this person for this tumor and they died.
Gotcha.
Right. So you cannot fudge that. You cannot say no. Oh, it was all good. No, you'll go to jail if you misreported.
Very interested about the score. So if, let's say, you just have someone that it doesn't tell you if they're doing higher risk patients than other.
No, they kind of normalize for all of that. So like a brain surgery for an accident, like a accident victim, is a very different thing from a brain tumor. So it's all normalized. So when they say a score, it's a normalized score. So you can compare apples to apples.
Okay. So yeah, essentially a handicap on like is high, high risk surgeries versus low risk surgeries and things like that.
Yeah. So they normalize for that. If it's a high risk surgery, then of course there's a huge risk of that not working out. So you should not be dinged for working on high risk. You need doctors to do that, but they normalize it so that all these scores are apple to apple. So all of those are comprehended. So then their benefit advisors found a doctor that had the rating of a 97%. That means 97% of their surgery outcomes were successful. Patient recovered. So that guy, went to that. So there goes your PPO, right? So those kinds of things are what is required in the healthcare system.
Gotcha. Let me ask you this, because for business owners that want to use the membership option in comparison with along with the plan that you help put together for them, you have, say, 7 employees that are on the north side that can go to the Meridian Springs office location, but then you have 7 employees on the south side that can't. Are they at a disadvantage in terms of overall cost versus say someone that is entirely in the, the Woodlands Conroe area?
No. So when you have the employer's health plan, the primary care is built into it. So that means you have two options. One is you can go to the network primary care, which is like your traditional primary care that you go visit the doctor. There's a copay, there's a deductible, it's an insurance claim, or you can go to one of our affiliate primary care offices across Houston. So when you go there, it's unlimited visits. There's no copays, no visit fees, nothing. So you have these two options. So we want to make sure that we do not, like, some of the employees probably have been going to their primary care office for 20 years. They don't want to change their doctor. That's fine. If you want to go to your own doctor, you can go to them. But then all of the copays and deductibles apply to that. But then, if you want to go to a doctor that's available all the time, then you have that option as well. So we have built everything without any constraints so that it works for both, people that are stuck with somebody that, they trust, they've gone over years, they still can go to them. But then we also have the option of you can go to this doctor, which is going to be your home base kind of doctor. If you go visit them, there's no insurance claim, there's no visit fees, there's no nothing.
So, Sunil, my company, we're moving our headquarters to Georgia. So we're not going to have any need for the membership option anymore because we're not even going to be in the area. None of our employees are going to be in the area. What would you say to a company that might be in another state?
Yeah, I mean, we can do plans in any state. I mean, actually, I would say I think about 21 states. Not California, not New York, some of those, but 21 states across the country. Georgia is big on this kind of primary care clinics and offices, and so our benefits will provide a benefits package that has the home based primary care offices there. Where not possible, you still have access to your primary care through the network. So all of these options are there.
So companies that have multiple locations in multiple states, even if they're headquartered in Houston and they have, a variety of different locations that that's within their operation, they can still, contact you and go through the process of doing that same situation if, versus say a small business here in the Woodlands, Conroe area.
Correct.
That's awesome.
Yeah.
Well, Sunil, I appreciate your time with us today. I really admire your process of putting this plan together. Membership options. I mean, it's one of and just looking at the insurance industry, the health insurance industry, it is a needed offering,
right?
Especially in the small business side. And I think that that the primary healthcare, that the primary side of what Meridian Springs is doing is amazing. So I'm very excited about that. I really hope that, if you're a small business owner or an individual that's watching or listening today, if you're coming up on enrollment period, give Sunil a call and then just kind of run through the conversation with him, see if it's going to be a fit and see what he has in his offering in comparison with what you have now. I think,
right.
In today's world, you need to have all the conversations. We're starting to get creative with health insurance, and that's, going back the last 10 years, it's a very, I would say a big light at the end of the tunnel, so to speak. I think that we still have a lot of ways to go to make health insurance more affordable for everybody, but this seems like a step in the right direction. Sunil, if you have anything coming up or any I probably don't have specials or anything like that you have going on now, but if you have anything that you'd like to let the audience know now, I'll let you carry us out.
Yeah, so for the employers, you mentioned about the enrollment coming up, so you don't have to wait for the enrollment time, mid-year or the end of the year. You can start now, just because usually we get busy at that point of time, and so it doesn't need anything. You can just compare what we offer and what you have today. If you don't have anything, what it would cost to provide your employees with benefits, and then when the enrollment period comes, then you can look into it and decide what to do. So that is a great thing to do now, when it's not really mid-year or the end of the year time when it gets crazy. So we can help you with that. We can also look at your claims. If it's a bigger employer, 50 plus, then we can look at your claims data to see how how the claims are being done. What are you being charged? What are your employees using? How we can optimize that? We can look at all of those things. And for individuals and families that live here in the Woodlands, Spring, Tomball area, uh, we can waive registration fees if you mention the podcast, and that you heard this podcast and want to join. We will waive the registration fees. For it's $75 for individual, and it's 145 for a family of four. So there'll be zero, if you mention this podcast.
Well, I like that. Sunil, I appreciate it, sir. It's been a pleasure, and we'll talk to you soon.
Thanks, Chris.
Finally finding me.